I'm Betsy Swope, and I'm a genetic counselor at Genome Medical, and I'm also the lead in reproductive health services. Even if there is not a family history of a genetic condition, there is still a risk that a couple could have a child with a genetic disorder. A family history typically indicates for us that there may be an increased risk for specific conditions. However, about 80% of children that are born with a genetic disease do not have a family history of that specific condition. The best time to talk to a genetics expert if you have concerns about having a child with a genetic condition is typically before you even consider having a family. That way you can have your family history assessed to see if there's any risks where very specific genetic testing could be offered and risks could be addressed, and therefore additionally genetic testing could be done at that time that could get you answers early so that all options are available to you prior to even being in the throes of a pregnancy. One type of testing that you can have as soon as you find out that you are pregnant is called genetic carrier screening. Genetic carrier screening is done on either a saliva or a blood sample that can be screened for up to hundreds of different conditions to see if you are actually a carrier for one of those genetic conditions. Being a carrier doesn't affect your health and doesn't cause any symptoms in you, but if your reproductive partner is also a carrier for the same genetic condition, there would then be about a 1 in 4 or 25% chance to have a child affected with that condition, and there would be testing that we can discuss that could tell you whether or not the pregnancy inherited that condition early on, as early as 10 weeks in the pregnancy. Other types of testing that can be done in a pregnancy involve determining whether or not the pregnancy may have a chromosome condition like Down syndrome. Some of those types of tests can be done as early as 10 weeks of pregnancy, and depending on your interests of what type of information you want to learn, there's both screening tests or diagnostic tests. Other types of similar screening tests involve blood tests and ultrasounds like first trimester screening, which is done at around 11 to 14 weeks of pregnancy. And then there's other types of blood tests that are done in the second trimester that can also predict chances of chromosome conditions, as well as birth defects like spina bifida. So ideally, we would encourage both the individual and her reproductive partner to have genetic carrier screening at the same time. That way you could have both of your results assessed and reviewed for any potential risks that both of those results would include. We know that that's not always feasible, so in those cases, an individual can be screened first and identified to be a carrier of either one or a number of different genetic conditions, and then the reproductive partner can be screened after that for an assessment of if that individual is a carrier of those same genetic conditions or not. When a couple is actually found to both be a carrier of the same genetic condition, there's a 1 in 4 or 25% chance that that couple could have a child with that genetic condition, and therefore we would then go into a much more deeper discussion about different options that are available to that couple. So that's why we encourage having genetic screening at the same time to just get results in a more timely manner.